A weak bladder is a common condition that affects many people. If you have a weak bladder, you may experience frequent and urgent urination, as well as urine leakage. This can affect your quality of life and make you feel embarrassed or anxious. But don't worry, there are ways to fix a weak bladder and improve your symptoms. What causes a weak bladder? A weak bladder is also known as overactive bladder, which means that your bladder muscle contracts too often or at the wrong time. This can lead to a sudden and strong need to pee, even when your bladder is not full. There are many possible causes of a weak bladder, such as 1. Urinary tract infections, UTIs. These infections are caused by bacteria that infect your bladder or urethra, which is the tube that carries urine out of your body. These infections can irritate your bladder and make you feel like you need to pee more often and urgently. They can also cause burning or pain when you pee, blood in your urine, or fever. 2. Medications. Some medications can increase your urine production or make you more sensitive to the signals from your bladder. These include diuretics, antihistamines, antidepressants, and some blood pressure drugs. 3. Caffeine and alcohol. These are diuretics that make you pee more by increasing the amount of fluid in your body. They can also stimulate your bladder and make you feel that you need to urinate. 4. Pregnancy and childbirth. Both of them can stretch and weaken your pelvic floor muscles which support your bladder and urethra. This can cause your bladder to sag or drop, which can lead to stress incontinence, which is when you leak urine when you cough, sneeze, laugh, or exercise. 5. Menopause. This is when your ovaries stop producing estrogen, a hormone that helps keep your vaginal tissues healthy and elastic. Low estrogen levels can cause thinning and dryness of your vaginal tissues, which can affect your bladder function and cause urgency and leakage. 6. Nerve damage. This can affect the communication between your brain and your bladder, which can cause your bladder to contract involuntarily or not empty completely. Nerve damage can be caused by conditions such as diabetes, stroke, Parkinson's disease, multiple sclerosis, or spinal cord injury. It can also be caused by surgery or radiation therapy in your pelvic or lower back area. 7. Excess weight. This may be surprising to you, but it can put extra pressure on your bladder and pelvic floor muscles, which can make them weaker and less able to hold urine. Losing weight can help reduce the stress on your bladder and improve your symptoms. How to fix a weak bladder? There are several ways to fix a weak bladder and manage your symptoms, such as 1. Pelvic floor exercises. These are exercises that strengthen your pelvic floor muscles, which support your bladder and urethra. They involve squeezing and relaxing the muscles that you use to stop the flow of urine. You can do them anywhere and anytime, but it's best to do them regularly and consistently for at least 3 months to see results. You can also use devices such as vaginal cones or biofeedback to help you do them correctly. 2. Bladder training. This is a technique that helps you retrain your bladder to hold more urine and reduce the urge to pee. It involves gradually increasing the time between each bathroom visit until you reach a normal interval of 3 to 4 hours. You can also use strategies such as distraction, relaxation, or deep breathing to cope with the urge when it comes. 3. Lifestyle changes. These include avoiding or limiting caffeine and alcohol intake, drinking enough water but not too much, quitting smoking if you do, losing weight if you need to, and eating a balanced diet that includes fiber-rich foods to prevent constipation. These changes can help reduce the irritation and pressure on your bladder and improve your overall health. 4. Medications. There are medications that can help relax your bladder muscle and prevent it from contracting too often or too strongly. These include anticholinergics, beta-3 agonists, or Botox injections into the bladder wall. These medications may have side effects such as dry mouth, constipation, blurred vision, or increased blood pressure. 5. Surgery. This is usually a last resort option for people who have severe symptoms that do not respond to other treatments. There are different types of surgery that can help fix a weak bladder, but usually, doctors recommend a bladder reconstruction or urinary diversion surgery.